What if I told you that supporting your lungs isn't just about prescriptions, but about understanding inflammation, mucus, immunity, and even stress? Before we begin, this video is for educational purposes only. It is not medical advice. Always speak with a qualified healthcare professional before starting any supplement, especially if you have asthma, COPD, allergies, or take prescription medications. Now, here's something important. Breathing problems often feel like a single issue, but medically, they're usually a combination of factors: airway inflammation, excess mucus production, immune response, environmental triggers, and in some cases, chronic disease. Researchers have studied several plant compounds for their potential supportive role in respiratory health. None of these cure disease, none replace prescribed treatment, but some contain biologically active compounds that have been examined in clinical or laboratory settings. Let's start with one that has actual clinical research behind it. Ginseng, particularly Panax ginseng, has been studied for its antioxidant and anti-inflammatory properties. Some controlled clinical trials suggest that in people with stable chronic obstructive pulmonary disease, supplementation may modestly improve lung function measurements and quality of life scores. However, it does not cure COPD, and results vary between studies. The evidence supports possible supportive use, not replacement therapy. Next is eucalyptus. Eucalyptus leaves contain a compound called cineole, also known as eucalyptol. Cineole has been studied as an expectorant and anti-inflammatory agent. Some clinical trials suggest it may help reduce symptoms in certain respiratory conditions like bronchitis and stable COPD when used as an adjunct to standard treatment. It works primarily by helping loosen mucus and supporting airway clearance. Elderberry is commonly used during upper respiratory infections. Laboratory studies show antiviral and antimicrobial activity, and some human studies suggest it may shorten the duration of common cold symptoms. Evidence is stronger for upper respiratory tract infections than for chronic lung disease. Now, at this point, most people assume lung support is only about killing germs or clearing mucus. But here's what nobody talks about. Respiratory health is also connected to immune regulation and stress response, and this is where the conversation shifts. Because airway constriction can worsen under stress, immune overreaction can increase inflammation. So some herbs have been studied not just for mucus, but for immune modulation. Astragalus has been researched for its potential immune supportive properties. Some studies suggest it may enhance certain immune responses. However, high-quality, large-scale trials for specific lung diseases are limited. Its use is best considered complementary and under medical guidance. Peppermint contains menthol, which activates cold-sensitive receptors in the airway. This can create the sensation of easier airflow. It may also mildly relax smooth muscle tissue in laboratory settings. However, it is not a bronchodilator and does not replace medications like albuterol. The relief is sensory, not structural. Lavender has documented effects on stress reduction. Clinical studies show its aroma may reduce anxiety and lower cortisol levels. While lowering stress can indirectly support easier breathing in some individuals, lavender does not directly treat lung disease. Horehound has traditionally been used as an expectorant, and it appears in some herbal cough preparations. Scientific data in humans is limited, but historical use supports its role in helping loosen mucus. Mullein has shown antibacterial and antiviral activity in laboratory studies. It has traditionally been used for soothing irritated airways, often as tea. However, robust human clinical trials for respiratory disease treatment are limited. Osha root has a long history in traditional herbal practice for respiratory support. Some of its compounds may have mild antihistamine-like properties, but modern clinical research remains limited. Bergamot contains antioxidant and anti-inflammatory compounds. It is more commonly studied for cardiovascular and metabolic effects. When used in aromatherapy, it may support relaxation, which can indirectly benefit breathing comfort in stress-sensitive individuals. Now here's the key takeaway. There is no single herb that cleans your lungs. Lung health depends on multiple systems: inflammation control, mucus regulation, immune balance, environmental exposure, smoking status, physical activity, and medical care. Some plant compounds show supportive potential. Many have promising early research. A few have modest clinical backing as complementary therapy. None should replace evidence-based treatment. And that's the part people underestimate. Natural does not mean harmless, effective does not mean universal, and supportive does not mean curative. If you're managing asthma, COPD, chronic bronchitis, or any diagnosed respiratory condition, your first line of care should always be a licensed healthcare provider. But understanding how these compounds work, inflammation modulation, mucus clearance support, immune interaction, and stress reduction, gives you a more complete picture of respiratory health. And that knowledge is the real advantage. Because better breathing isn't about trends. It's about informed decisions, evidence-based care, and responsible support for one of the most vital systems in your body.